Welcome to Active Points Wellness. My name is Warren Schick, and I'm continuing along with self-care tips for shoulder girdle and neck injuries. And the last few I've been talking about different shoulder mobility exercises using AccuMobility and kind of self-myofascial release techniques. Well, today I wanted to talk a little bit more about stretching and how to use stretching effectively to incorporate into your self-care plan for your shoulder injury. And what I would recommend doing is utilizing stretching as a kind of a consistent part of a daily practice. And you want to do it when you know that you are kind of through with the day's intense activities. So if you're someone who likes to go to the gym and work out or plays some sort of active outdoor sport, and you need your body to be in good physical condition to perform the activities of your day, I would leave static stretching for the end of the day or the end of the workout, and allow yourself the other types of activities, more dynamic warm-up and dynamic exercises, as preparatory exercises for your sport. But when used for a mobility type of program, stretching can be a really effective tool. And so we've done some of the self-myofascial release of the pec minor and the infraspinatus and some of these other muscle tissues, lower trapezius, middle trapezius. What I want to do now is work on a stretch for your pec minor muscle group. So it's again that muscle that attaches to the rib cage, these upper ribs, and then inserts into the coracoid process of the scapula. So often with this upper cross syndrome or this forward rounded shoulder position that we get into with the heavy use of computers and telephones and things, or smartphones and things like that, we often get this kind of forward rounded and a really shortened pec minor position, which then inhibits or restricts some of our range of motion for our arm and shoulder. So what we're going to do is a simple stretch in which you're going to place the arm above and to the side of your body. So it's not directly overhead and it's not straight out to the side. It's kind of at this about 30 or 45 degree angle. And what you're going to do is take a staggered stance with your feet, and you're going to brace using your abdomen and all of the core musculature around your waist, and plant and hold the hand. And then what you're going to do is turn away from the hand and lower against the wall. So it applies a stretch in and across not just the pec minor but also the pec major, and even some into the lats, which are all muscles that tend to internally rotate and shorten as our arms come by our sides. So we're going to try and reverse that and open the hand and drop our body weight into the pressure, and we're going to hold for about 10 to 15 seconds at a time into a mild to moderate position where you feel a little bit of a stretch. And then what we're going to try and do is engage the muscles that we're trying to shorten and hold that posture. So our mid-back muscles, and really trying to pinch your shoulder blades down and back. So we're engaging muscle as we apply a stretch to the opposite muscle group. So holding and then releasing. And again, you're going to perform this about maybe 6 times, and 15 to 20 seconds maybe on the high end. 6 or so times, 4 to 6 times would be kind of ideal. And again, we incorporate this as part of a generalized shoulder and neck mobility program. Okay, so 4 to 6 times a week, perform each exercise, just one set, but maybe about 4 to 6 repetitions, and holding for about 15 to 20 seconds for each repetition. You do that and you should feel some increases in mobility over the course of maybe a 3 to 6 week period, and you should be starting to feel some of the benefits of your practice. I hope you're having a great day, and look forward to seeing you next time.